Hey guys, welcome to Spinal Hygiene Exercises 2.0. I'm Dr. Norris Goldberg and I am the owner and clinical director here at Koru Chiropractic. So let me show you some of these classic exercises that can really help improve your forward head posture. All right, so the first exercise is the simplest one. It's the one that, like, when I learned this, I rolled my eyes. I said, there's gotta be more to strengthening your neck and your posture than this. It's not the end all be all, but this is a pretty good one. You know, it's kind of one of those oldie but goodies, okay? So what I want you to do is just lean up against a wall here. I've got my feet a little bit further ahead than my hips and my shoulders, so I'm nice and flat against the wall. Maybe just like put your arms out to the side a little bit. You feel the shoulder blades really flatten up against the wall. Now, some people, their head is still out here in space. So if you're dealing with forward head posture, you might notice that you're like, yeah, I'm still not really on the wall, just my shoulders or just my butt is touching the wall. So again, I want you to try to make as much contact with the wall through this section right here, through your torso, okay? And then we're gonna work on getting that head touching the wall. So you're gonna just take your head and go straight back and take that little knob, right where women usually tie their ponytail. There's a little ridge kind of right in the back of your hair, right about the level of your ear. That's your occipital ridge. And what you wanna do is just take the pressure from your neck muscles and press it right against the wall. You can see when I'm pressing really hard, it almost changes my voice a little bit. I feel a little activation in my deep cervical muscles. So what's really happening is I'm activating the muscles behind my throat and my vocal cord. That's why it's changing my voice. My head is holding against the wall. My back and my shoulders are touching the wall. And I'm breathing. All right, super important to breathe, guys. This is one of those things, I'm gonna go back to it. If you haven't watched the breath work video, take a minute, watch it. But once you get set up and you're like, okay, I'm doing it right, Dr. Norris, I know how to get my head against the wall. I can feel that pressure in my throat. I can feel a little, almost like stretch happening through my neck and my shoulders. Make sure your shoulders aren't kind of trying to help out. It's not a shrug, it's a chin tuck. So it's really a retraction of your neck, going back like that, which makes it look like you're tucking your chin and getting a double chin, but it's really not a tuck down. It's not a tuck, it's if anything, a tuck and a pull back. And when I do that, I feel it deep in my throat right here, okay? So pull straight back. Granted, I wouldn't want my mugshot to look like that, but if that makes my neck and my posture look better in the long run, just like me, I'm sure you'd do that too, right? So a couple seconds. Now there's a few variations of how we can do this, right? First thing is, we can just do like 3 to 5 second holds, maximum squeeze or contraction, pushing that head into the wall as hard as we can. Most people need to start there because they don't have a lot of endurance or strength in their neck, okay? So it's gonna be like 1, 2, 3, hold, relax, maybe inhale, hold, 1, 2, 3, 4. Relax, breathe, exhale. Inhale and press. 1, 2, 3, 4, 5. Exhale, relax. Okay, so pretty straightforward, nothing crazy about that. What I want you to do if you do that variation is relax in between, about 10 to 12 reps each. That sort of still gets you into that 30 to 60 second zone, 30 to 60 second zone that will allow you to strengthen those neck muscles. Now, when it gets better, when you get stronger at this, you're gonna say, I can do 3 to 5 seconds, no problem. So hey, it's kind of like doing a plank. First step to doing a plank is, can we get into a plank? Second step is, how long can you do a plank in that position, right? So we're not gonna plank just yet, but what I wanna do is chin tuck and hold for a long time. So now I'm gonna hold for like 30 to 60 seconds. I'm not gonna move very much. I mean, you can see me move my arms, but what I was trying to do there was just like test, make sure my back and my shoulder blades are against the wall. And I'm talking, I'm breathing, right? So, if I wasn't talking, I could just focus on but essentially maintaining that pressure. What you'll notice is over time, as your neck gets tired, is you're like, oh, wait, I'm not even pressing against the wall anymore. So really think about that. Like, are you maintaining that pressure for 10, 20, 30 seconds? Eventually, let's try to get it up to about 60 seconds, okay? Now, here's third variation, and this is the hardest one, and in some instances, I would recommend not doing it. So here's who should not do this. If you have diagnosed instability in your neck, If you haven't heard me say it or you haven't heard another doc say it, you probably don't have it. But if you have it, we don't want to overstress the neck, and this, in some cases, could be too challenging. It's highly unlikely that you would like hurt yourself in a permanent way, but you could definitely aggravate your neck and the muscles in your neck, okay? So again, if there's any hesitation, this is the least important one. This is for like bonus points. Most of the time I'm doing this with like my young athletes and maybe like people under 40 with no degenerative changes with their spine and they're pretty active, okay? So if that kind of sounds like you, give this one a go. So this is the neck wall plank, okay? Neck wall plank. And what we're gonna do is I'm gonna have my feet about a foot off the wall. And I know you can't see that. I'll give you another view of that in just a second. My feet are about a foot off the wall. I'm gonna set myself up just like before, but before I lift myself off the wall, the first step I'm gonna do is I'm gonna squeeze my glutes. That's pushing my hips forward. And then the second step is I'm gonna push my head back. And when I do, and I activate my neck muscles, you can see I get to that same kind of like double chin spot. Now though, my back is off the wall. The only thing that's touching is that ridge on the back of my head, and I feel nice and stable. Honestly, my core, I'm kind of pulling my belly button up into my diaphragm here. My glutes are squeezing forward, and I'm feeling tension from my occiput really down to my feet. It's nice activation of my postural muscles, and if I could hold this for 30 to 60 seconds and continue a conversation with you, I'm doing pretty good. All right, next, let's talk about wall angels. Wall angels, a lot of people, if you've been to a physical therapist for your spine or your shoulders, you might have had this exercise given to you. This is an exercise that is both an assessment and an exercise, meaning when you do this, if you're having trouble doing it, come into the office and show me, because I could then look at it and say, oh, let's focus more on stretching this muscle or stretching this muscle, or maybe it's this muscle, whatever it is. I can tell based on how you're moving through the wall angel motion, okay? And if it feels pretty good, like if you feel like you're getting better and stronger at it, I might be able to give you enough information just in this video that you can run with it, okay? So I'm gonna stand up against the wall. I'm not gonna lean against the wall, I'm just standing really close to it. And then I'm gonna put my hands at about 90 degrees like a cactus, okay? And what we're gonna do is I'm trying to maintain the contact between my fingers, the back of my hand, my wrist, my elbows, and my shoulders. And so right now, everything is touching. If anything, I could see in the video and I can tell like I'm arching maybe a little bit in my back. So I kind of wanna activate my core more, but right now, just fresh off the hockey rink, to be honest, I'm feeling a little tight in my shoulder. I can tell if I activate my core, I'm gonna come off the wall a little bit. So real life problems. I'm human just like you. Like this is not always a perfect exercise for me. So let's workshop this one together, okay? So I'm pushing against the wall. I'm actually gonna like kind of suck and brace my core into the wall. And then I'm just gonna reach up as high as I can into like a Y position and then come back down and then reach up and come back down, okay? What you'll notice is sometimes one arm is going up and the other arm like can't quite stay on the wall at a certain point. Like maybe your wrist is coming forward or you're keeping your wrist touched, but like one elbow's touching and one elbow's off the wall. With some other variations would be like as you go up further, again, both arms come off the wall, or as you go up further, you feel your back come off the wall and you're really like arching in your low back. Those are signs of tight and weak muscles that need to be addressed. So the best way to do it, one of them, the simplest way, is just keep doing that exercise, right? So the first part is like, can I do it right? Second part is, can I get better at it, right? And so I want you just to practice it, reps and sets, maybe about 10 to 12, 2 or 3 sets. So I'm just gonna work through this. I can really feel as I like squeeze my shoulder blades down, some different levels of activation in my back as I start doing these more and more. All right, so give it a go. If you're having any trouble, can't keep your hand or wrist in the wall or your elbow in the wall, bring up those details to me and I'll help workshop it with you. All right, now I want to talk about the third and the final exercise. These are called Y's, T's, W's, and I's. Y's, T's, W's, I's. All right, so this exercise is performed for postural reasons, for shoulder rehab reasons, athletic reasons. Like I've been doing this one for 20 years, okay? It's excellent. Now, there are variations that allow it to be much more challenging. I'm making this variation for the simplest level, and then I'll tell you how you can make it more challenging down the line, all right? So we all know the song, YMCA. Pretty much, here's your Y, right? I'm not gonna touch the wall, I'm just standing close to it so you can see as much of me as possible. Here's my Ys. So I'm gonna do 10 Ys. Try to keep those ribs down, right? Don't let your ribs pop up every time. I'm gonna keep my core activated and reach up as far as I can. I should be able to get my biceps to my ears. I don't touch my ears, I was just trying to show you like they're literally at my ears, meaning I'm getting my shoulders and arms back far enough for a healthy range of motion, okay? That's about how you wanna be able to come up to about 180 degrees from the straight down, right? 180, right up there. Okay, so Ys, here's the Ts. You're gonna start here and then just go to the side, right? So Ts, and then Ws, we're gonna start like here and then come back, okay? So I really want you to make that motion with the elbows like I'm coming back and around here. I'm really feeling the squeeze behind my chest, in my back down here, okay? So it's not up here, specifically, especially with the Ys, down low, almost like if you're a lady, bra strap level, okay? And then the last one's Is. This one's the toughest because if you've got some shoulder issues going on, if you banged your shoulder up a few times or dislocated it, it's not impossible. Probably a sign that you should be doing more rehab on your shoulder, but sometimes this is where people will feel a little bit of the pinch. So I'll start straight ahead and then I'm gonna go straight up, right? And as I go up, obviously, so here's the I, this is a Y, okay? A little different. The reason is we're using different muscles here. So Ys versus Is, okay? So as I'm coming up, now, standing, or you could even do those seated, is like the easiest way to do that, right? And you're really just fighting a little bit of gravity. But another way you could do it is you could lean yourself like off of like a Bosu ball, right? And so I could like lean off of, or like what we call in the gym, we would call it a Roman chair. So it's like got those back extension chairs, right? Where you have the pads and you kind of lock your ankles in and you lean forward and then you come back up. Well, I do it where I just lean forward and then I do the Ys, Ws, Ts, and Is, sometimes with just my body weight, just AKA just my arms, sometimes with a very light weight. I don't know if I've ever done more than 15 pounds, but usually 5-10 pounds does the trick. Great way to warm up your shoulders if you are weightlifting. Awesome way to get into the exercises, the heavier ones. And of course, if you've had shoulder problems, this is actually something you should be able to do. So it's both an assessment of what can you do and what can't you do, but it's also an exercise to help get you stronger and help rehab the different ranges of motion within the shoulders. Stay tuned for another video where I'm going to show you shoulder cars or controlled axial rotations. That's going to be coming up in week 4 of your exercises. All right, guys, so Spinal Hygiene 2.0, hope you enjoyed the forward head posture activation exercises. You got 3 good ones there to work on, and let me know how they're going when you come in for your next correction. I'm Dr. Norris Goldberg, and again, if you haven't subscribed, you're crazy. Please subscribe, because I'm gonna make some more videos and I want you to make sure you see them. See you soon.